work with providers, we work with employers. They hire us and license Radical Health to be available, right, to their communities or to their employees. And what's really important here is, to the point of like, how does this impact both like especially on the financial side? What we know today, right, is that 90 million Americans don't have basic health information. And it doesn't matter how much money you make, who you know, it just is complicated. I mean, what's an mRNA vaccine over? I mean, we've all seen this year. It's wild. And when that happens, right, and you don't understand what's going on, we really start to tap into, I think previously we'd maybe called it like health literacy, but I think we're using this term like health fluency, right, which encompasses literacy, so like the ability to read and write and understand like knowledge, but then also like the actual knowledge of healthcare, right? So understanding the pieces, right, the ways that the system works, the way that maybe, right, you might need a prior authorization before you can get a procedure done. Then we run into like perception. So like, how do my customs and my culture impact how I view the healthcare system? Which means I'm Puerto Rican. We use Vicks Vapor Rub, which is like a menthol rub for everything. That's your first run, right? Like before you do anything, you got to use some Vicks. And that's just the culture and that's just the perception. So before I call my PCP, we're just going to see what we got here and make it work. But that's my unique cultural perception. And others have, different ones. And those are pieces that we need to incorporate into this understanding. And the last component that when we think about like this overall health fluency is really around confidence and trust. And so, today, only 44% of Black Americans actually trust the healthcare system to do what's right for them. And that's 20% less than white counterparts. So we're seeing a big, people don't understand, right? We have this like lack of like health fluency that doesn't really encompass all of the things that I mentioned. We don't have confidence in a healthcare system. And when you have those things, right now you ask people who have low health fluency, ask about 50% less questions when they're in a doctor's visit. And so it just makes for like, I think about like a job interview, right? Where I'm like, do you have any more questions? And you're like, no, I'm good, right? Or do you have any questions? You're like, I'm good. It doesn't make for a good experience. And that's just, to the financial piece, it's just costing us billions and billions of dollars. For someone with low health fluency who's on Medicaid, they cost annually about $10,000, which is 4 times higher than someone who has high healthcare fluency. That's around $2,600 a year. And this is like a community, cultural, people issue, but it's also a financial issue that we are working really hard to fix.